This is the cover page to the State of Ohio versus Big Pharma lawsuit filed May of 2017 for the inappropriate promotion of prescription opioids for long-term chronic pain use. This 152-page document clearly states Ohio's position on opioids for chronic pain. It states dozens of times opioids are unsafe in most circumstances for long-term chronic pain use. So why does the state of Ohio continue to permit its state licensed professionals to continue dispensing dangerous, deadly drugs in a manner it states is clearly unsafe? The main reason, in my opinion, is we have failed to empower the state medical board, the Ohio State Pharmacy Board, with the proper legislation. This is now more than just Big Pharma's responsibility. From the state of Ohio's factual allegations, before the 1990s, generally accepted standards of medical practice dictated that opioids should only be used for short-term acute pain. As a result, doctors generally did not prescribe opioids for chronic pain. The state of Ohio also says that defendants, Big Pharma, targeted susceptible prescribers and vulnerable patient populations. For example, defendants focused their deceptive marketing on primary care doctors who were more likely to treat chronic pain patients and prescribe them drugs, but were less likely to be educated about treating pain and the risks and benefits of opioids, and therefore were more likely to accept defendants' misrepresentations. The state of Ohio also says, for these reasons, the CDC concluded that efforts to rein in the prescribing of opioids for chronic pain are critical to reverse the epidemic of opioid drug overdose deaths and prevent opioid-related morbidity. Cause of actions from the state of Ohio versus Big Pharma lawsuit. And by the way, the cause of actions is a legal term about the facts that give a person the right to seek judicial relief. The first cause of action listed is Public Nuisance, Ohio Product Liability Act. The second cause is a Public Nuisance, Ohio Common Law. The third cause is Ohio Consumers Sales Practices Act. The first cause of action deals with manufacturers' responsibility of its products and the safety and harm risk to the public. The third cause of action is a much more interesting topic because this law uses the term suppliers and not manufacturers. And in this code, suppliers by definition is the entity that solicits the sale to the consumer. So I wonder if physicians and pharmacists have some responsibility for being the suppliers, as they are the ones that solicited the consumer to use these dangerous drugs.
For many years, decades really, doctors would never prescribe any opiate painkillers for any kind of pain, or very rarely and only under very strict scrutiny and that kind of thing. All with the fear that there would be they would be addicting patients. Beginning in the late 80s and really accelerating in the 1990s, there was what amounted to really a revolution in practice, in prescribing and how pain was treated. The effect of that through the 1990s was really to expand the amount of the numbers of routine surgeries and instances in which these pills were prescribed, and also to expand the amounts that they were prescribed when they were prescribed. It was not just that these pills were used for situations in which they'd never been used before, It was the quantities and the quantities that were then sent home with people. Doctors all across the country bought the idea that they could prescribe these pills to almost anybody risk-free of addiction. Wisdom tooth extraction was now 60 Vicodin, when every dentist knew that none of their patients would ever use 60 Vicodin. They might use 5 or 6 or maybe 10, and the only ones who would actually really use 60 Vicodins were those who would begin to abuse it. On the other hand, a lot of people were prescribed those things, using them exactly the way doctors ordered, became addicted too. And so you have you have this massive supply out there for last 20 years really. And you have all these people who are being gradually addicted to them. The pills are seeping out into the black market as well. And you have a kind of the catastrophe that we've seen in that's been going on for the last 15 years, but only really been recognized seriously and clearly in the last year or so.
And I heard about an increased number of deaths from opiates, now exceeding, with prescription opiates, deaths from heroin and cocaine combined. I heard from our Birth Defects Center about more babies being born at risk for congenital heart defects because their mothers had been taking prescription opiates. I learned about more falls among the elderly who were taking prescription opiates, about more drugged driving crashes. And just about the only mortality statistic getting worse is the increase in death from prescription opiate abuse. This is a major public health problem, and it's getting worse and getting worse rapidly.
And this is a sentinel health event. We are awash in opiates. We have not got right the balance between risks and benefits. By all means, for palliation of someone with cancer, we need to treat their pain. But for chronic pain, back pain, headache, you'd be hard-pressed to prove that the benefits of prescription opiates outweigh the risks of what are clearly dangerous drugs. A few doses result in addiction. A few doses too many result in respiratory suppression and death. Over the past 10 years, 145,000 Americans died from overdose from prescription opiates.
The epidemic we have in Ohio is fueled primarily by the pain med problem. We think about at least three-fourths of the people who are on heroin started with pain meds. The same thing would be true with fentanyl and carfentanil. So it's not just the people who are dying in Ohio of overdose of the pain meds. It's what ultimately that leads to. They get them addicted, and then they move on from there. So this is really cutting at the heart and soul of Ohio.
The Washington, D.C.-based Kaiser Family Foundation published statistics that showed Ohio was the leader in the nation in prescription opioid deaths in 2015. The National Safety Council out of Chicago, Illinois, published an article that states 99% of the doctors prescribe highly addictive opioids longer than CDC recommendations. This comes from the 2016 Ohio ORS annual report. It shows no reduction in opioids dispensed on a per patient per dose review. The top graph shows year 2010, the average prescription was 64 pills. And in 2016, the average prescription was 65 pills. The lower graph is an opioid dose per patient per quarter graph. 2010 shows 147 pills per patient per quarter. 2017 shows 141 doses per patient per quarter.
This has been one of the great mistakes of modern medicine.
Dr. David Kessler, who ran the FDA from 1990 to 1997, doesn't hold back when talking about the explosion in opioid use in the last 2 decades.
Who's to blame? FDA has responsibility, the pharmaceutical companies have responsibility, physicians have responsibility. We didn't see these drugs for what they truly are.